My name is Tamia Stewart. I'm your HIT coordinator. I have cards there. If you need them before you leave, if you need to contact me, I help you with planning your, thank you, Frank, your educational path in your the Coding Cert program or your HIT program. So you can, best thing to do is call me, make an appointment, so I'm not running out the door as you try to catch me, because that happens a lot. And I don't mean that to say that I have to see it another time, but that happens, because everybody has meetings here in the educational world, and then also a lot of students need to see me. So, tonight we're going to celebrate HIP Week, and Health Information Professional Week. And we were lucky enough this morning, we had Deborah Reister, and she had an excellent presentation. And then we have Lena Truncale, Ms. Truncale, one of our adjunct professors here, and she's also going to give her bio. I'm going to let her do it, talk about herself too, because that's one of the richest things that I think that we can share with you is our history. To let you know how we got to this, into HIT, and our path throughout our work path. So it gives you some ideas, gives you some history and some knowledge about how the HIT field and the wealth of it. And then we have Ms. Williams here tonight with us, and she's been here in the morning, and she could share with you the interesting presentation we had. I'm going to try to put the presentation out on the hub because we did tape, and we're glad we did. So enjoy the evening. If you want to walk back and get a piece of pizza before it gets cold, go ahead and get it. We're casual tonight, and then we got some water and everything like that. All right, thank you, Ms. Truncale.
Well, it's great to see everybody tonight. I know most of you in here, and everyone I take is either in HIT or coding, correct? And so just to tell you a little bit about myself, my name again is Lena Truncale. You're probably thinking, wow, Truncale. I didn't know they had black Italians or anything like that. But no, I'm not Italian, but I am black and Hispanic. So I have a family on my mother's side that's from Panama, and so I do speak Spanish. And as far as how did I come to know about HIT? How did I really come to understand it? If anybody had told me I was going to be working in healthcare, I would have told them no. Never would have worked in healthcare. I moved here in 1997 from South Bend, Indiana, and I ended up working at a healthcare facility there that was considered what we would call an FQHC. It's a federally qualified health center. And at the time of Heartland Health Outreach, they actually had a program that was geared toward the homeless. They only served health populations for homeless persons in their shelters. And so in working there, it was a small entity, very small, but it was a non-for-profit organization. So they started here in the city as Travelers and Immigrants Aid, working with a lot of families that would come in really by transit from the trains, and working with immigrant families to get them acclimated to American life and letting them know what they may qualify for, whether it was different social programs, whether it was how to enroll your children into school, and then as well as greeting those ones to take care of their healthcare needs. Well, there at Heartland Health Outreach, I learned a plethora of positions because it was so small, so I had an opportunity to really learn about it. As a federally qualified health center, they received a lot of grant funding, federal, state, as well as local dollars to provide care for the homeless. And so there I started out as an administrative assistant, working for the associate director of the program there. And in that position, I kind of got to see how it functioned, where the money was coming from, answering phone calls and such for our director. And then I was cross-trained to work as a receptionist. And then from the receptionist, they were like, oh, we need you to do patient registration, because some of the patients, of course, a lot that were coming in that may have been indigent were persons that may have been Spanish speaking. So I will help out with patient registration. Same year, so one of our health information, our medical records person was ill. He had a heart attack, ended up working in medical records. So I got a chance to see how the medical records function. And then, because we were shorthanded, I would help billing and actually would post Medicare and Medicaid payments for our patients in the clinic. So in that short span of time, I really got an opportunity to see each little aspect of the department. Now it's grown to over 100. They have 6 sites at that location. And over the years, I worked there for like 5 years. I ended up working at another federally qualified health center in Indiana. Worked there for a year. I was doing case management, a little bit different functionality for me. And then I ended up coming back, working back for them, and stayed there another 5 years, worked at Infant Welfare Society of Chicago for about 5 years after that. And now I am currently at AXA Assistance. AXA Assistance is a French company. It is a corporate global Fortune 500 company that provides a lot of services, in particular for services for persons that may, for various contracts. Right now I'm working for an agency that got a huge contract with Blue Cross Blue Shield to do claims processing for their international claims. Which means for me, if you can think of any federal agency that's outside of the United States, I see those claims. Germany, Japan, South Korea, where else? India, Dubai. I see claims from all over the globe that are coming in where persons have sought healthcare services and now they're trying to seek reimbursement through their insurance. So that has been a very interesting process for me as a health professional. In my start though, I didn't know about health HIT. I'm a business major. I went to school at Indiana University, graduated in '95, so I have a bachelor's in business management. Never dreamed I'd be working in healthcare. I came and moved out here and actually ended up working at the health center, and through those aspects and through those departments, I was like, wow, this is really interesting. I think I can do something with this. So the nerd that I am, I went online and started Googling stuff about billing, coding, and stuff. And I came across the AHIMA website, the American Health Information Management Association, and read a lot. I read everything that was on there, everything. At the time that I started looking at programs, I was considering community colleges, but I really wanted to make sure I was at an accredited program. So you know the value of going to an accredited school because you're going to get what you need and be prepared as you go into the workforce. And so I decided to come here as a student. So I started here in 2003 as a part-time student here, going towards the program. Initially I said, oh, I'll do coding, I'll go for the coding certificate. But I always had a value, there's always a value, nothing against the certificate program, but I wanted to have versatility in my career. And so I wanted to go for an HIT program, so that's when I switched over and stuff. I got done, not the most timely fashion, but I did get done. I graduated in 2007. I took some time because of financial responsibilities. Took me a little longer to take my test, but that doesn't mean I wasn't studying. I was cracking open those books, looking at different stuff. I took a year to study. I teamed up with one of my classmates, and we helped each other because she was stronger in different aspects of classes, and I was stronger in other aspects, and we worked together. We worked to try and get each other going. So I finally took my test in 2008, and I've been credentialed ever since. Okay? So I'm here as proof to say you can get through this program. You can get through it. It is possible. And a lot of our students have gone through, they're doing excellent. We have one She graduated. She's actually working at a hospital and is now like a supervisor in as far as health information, as far as release of information goes. Have another one. Her father is a doctor, so she's working at her father's practice, but she has increased their revenue because of her coding education here at this program. So now her father has entrusted her to manage her their office. Have another student. They're actually out in the field. She's coding. She's out in Swedish. They finally offered her a good position with a raise. Doing very well. So students from here do achieve what they're looking for. So don't think that you can't. Okay? One of the things that I wanted to talk about was that, you know, as you're a student, and a lot of times the environment is changing a lot, you need to seize your opportunities. Don't think that because you're a student that you cannot get into the position that you're looking for. You may be even able to talk your way into a position. That's kind of what happened to me when I was at infant welfare. They posted a position because they wanted to have a credentialed person. And the way they posted it was that they were looking for an RHIT or an RHIA. So at that time, because I had switched positions, I had a gap, so I was doing patient registration at the time, and entitlement benefits enrollment, like for Medicaid and the Kid Care program or All Kids program, I was doing that. And so I saw an opportunity, and I had a good conversation with our HR person. I go, if you are willing to manage or work with me, I guarantee, and I wasn't done with the program yet, I guarantee I will get done in 1 year. I'll be credentialed in 1 year, and you can hire me as your supervisor for that department. And then she was very curious to know, well, what is it that an HIM professional do? Don't you think that's a funny question an HR person would ask, right? They don't know our capabilities. They do not know our capabilities. So I started telling them, well, my education included learning about medical terminology, pathophysiology. I have to learn about coding, the anatomy of the body. I can see if there's something abnormal coming on the lab that I need to forward it to the physician. I know quality management. I know information systems. I've worked on implementation programs for EHR at my other job before I came to join them. So that opened up an opportunity, and they say, okay, we'll work with you. So I actually got into my position as a supervisor for the department, and then they allowed me to flex my schedule. I was still working 40 plus hours a week, going to class, coming here, studying for tests, sitting for tests, and doing research papers and all that. So don't think that you can't get into a position. The other opportunities that you do have, so with that opportunity, have confidence in yourself. Have confidence that you'll be able to get where you want to be to start. Don't think that you won't be able to, because you never know. You may be the one that they need. They may not have they may be running the total department and not have a credentialed person. That was the situation where I was at the time. By the time I graduated, I was the only credentialed person. Okay? They were running and that you find was pretty typical in most community health centers. They didn't have a lot of credentialed staff. Now, through time, and because you have budget crunches, grant funding is getting low, you want to maximize your revenue. So you want to have the proper people in place. Okay? And so as I was there, I was in that position for a little while. They decided they wanted to hire a director. And so those that came this afternoon, earlier at 2 o'clock, Ms. Reister joined. She joined in 2007 at Infant Welfare. And she really valued the things I had currently shared with management, and she decided to seize an opportunity to try and bring some other things to the table. So while I was there, she wanted to try and see, okay, we need to get better with our actual billing for Medicaid, because that's the majority of the population of infant welfare is on Medicaid. And since that was our biggest payer, you want to make sure your claims are clean, right? That the billing is clean. If you get a rejection, that means you're not getting money. You got to go correct it, and you got to resubmit it, and then that takes time for them to actually get their money. And because we all know that the state is in a crunch, and so to avoid that, they wanted to look at how are we currently billing. So Ms. Reister, she said, well, you know what, Lena's out of school. Can we do a project in which we look at the pediatric records and see how is it currently coded? Okay, those that's had 100, right, or have worked in healthcare, you get those different, the actual encounters, and the doctors like to check off what they did and everything and put that diagnosis on, right? But then here comes the auditors. They come in. We're here to audit you, and we want to look at all your records going back 2 or 3 years. They start looking at records, they open it up, they look at the encounters, they compare it to the documentation, they compare it to that, and then they start saying, well, you're missing certain things. You're missing this immunization that you said you give, but you didn't bill. You're missing diagnosis here that you could have billed, but you didn't. You undercoded when you did so much work, which shows you could have had a bigger reimbursement on this particular claim. So rather than looking at what they were currently doing in their audits, I started looking at the pediatric records and trying to compare, because at the time the state was looking for different incentives to bestow to those that were doing great health care, such as looking at different quality measures. Okay, you have so many, a certain population of pediatric patients. Well, if you are at the 80% percentile for making sure that all your pediatric patients had all their shots timely, we're going to give you a bonus. Okay? If you make sure all your patients that have asthma had an asthma review quarterly, we're going to give you a bonus. So then Medicaid programs started doing this. And so as a community health center, you want to maximize on those opportunities. And you want to seize those opportunities as they come along. So through the auditing process, we were able to identify, okay, they're not doing proper documentation for vaccines. They're not listing certain things in the record for the lot numbers. Maybe they missed one that they should have put down for the other, or there was a transfer of numbers here or there or whatever. And going back to staff to remind them, okay, do these checklists so that you're keeping that into focus. And so through those efforts, it was like, oh, we like this. So after 9 months of doing it as a project, they decided to move me into a permanent coding position, just to do that. And then to work with the providers to educating them on coding regulations and guidelines. And so through those efforts, it ended up being an opportunity that I didn't know would ever come to be, because you don't really hear of coders being in that capacity, at community health centers. But now it's growing. You're actually seeing more positions come up for coding. You're actually seeing more where they want someone to be have some coding experience, or at least a coding background, even for front desk registration, handling front desk operations on that end, doing the actual data entry for the charges at the end of the day when they're putting in the charges and such. Okay, so opportunities come, you need to seize your moment. The other opportunities that you have is networking. You gotta be able to network. The people in this room, guarantee you're gonna cross their path and you are gonna be helping them out, or they're gonna help you. It's a very small population or market for us. okay, you're going to cross paths. I crossed paths with one of my students the other day. You know, so it happens. It happens. So if you look around, I might be sending something to Miss Vashana Thomas over there, when she's over at her hospital, or I might be sending something to Hari Choi if she's over in her spot. Okay, so you will be coming across certain paths. One of the greatest ways to network is to try and go to the annual meeting. You know, AHIMA and ILHIMA, they both have their meetings. If you can travel and you can do it, especially as a student, because you get a great discount, you have a great opportunity of learning and meeting other professionals, and they are so receptive. They give you ideas on what you can do. One of my best experiences was that I had an opportunity to go. When I was working at infant welfare, and because of the position I was in, I was able to go to a conference and use my student discount. So because I was still a student, remember when I started, so I sought that opportunity. I went to St. Louis, went to workshops, was there for 3 days, got an opportunity to meet other professionals. And at the time, it was like a joint state meeting, so it was both Missouri and Illinois that actually hosted a meeting down in St. Louis. And so, as a student, I got a chance to meet a lot of different professionals, fellow students, other professionals. There was one person that we really hit it off really well, and I still keep in touch with her to this day. She's now teaching. She was working in a major hospital system. 2 hospitals of hers were merging, so I got to hear all about that. And some of the challenges and some of the challenges that they were going through as they merged different records and things that you normally hear about as you go in those circumstances. But it was a great opportunity. And for quite a number of years, I've always tried to go to the annual meeting because it's a great way. They have different vendors that's there. Even if you're a student, they're interested in knowing, when are you getting out? You should send me your resume. If what are you interested in? Well, you might get into this aspect, or you might try and go into this. They will give you all the opportunities in the world to tell you what you want to get into, or what your interests are, so that you can get into those type of positions. And there'll be like hundreds of vendors. They might have up to 80 vendors at the state one for ILHIMA, and they might have over 100, 200 for AHIMA, for the national conference. So if you can make it to an annual conference, it's a great opportunity, and you should take advantage of it. You really should. And interestingly enough, our annual meeting for AHIMA is next month. It's actually the week that we start the spring quarter, I believe, the April 4th through the 6th, down in Tinley Park. That's the next one. Okay, so it's Thursday, Friday, Saturday. Okay, so if you have an opportunity, go on the ilhima.org website. You can sign up online to go to it. It's ilhima, ILHIMA.org. Go to the website. As soon as you get to the main page, it's right there in the corner. You can't miss it. Okay? And they have a great student price for all 3 days. And the thing about it is they don't treat you like a student. They treat you like you're a professional already. Okay? So everything that is going to be talked about, discussed, things, you get the same information. They don't treat you any different. As far as they know, you're a professional already. Okay? So take advantage of those opportunities. Incidentally, if you're going to Atlanta, the one in Atlanta is in October. If you like going down to Atlanta, they have one, that's the national conference for AHIMA. Okay? So if you're in that area and you want to check it out, go down to the Peach State, and go down there, you can go and stuff. Student membership, again, great opportunity, great discount. Okay? The way you get knowledge is by keeping up. You have to keep up. If you are in this field just to get your certificate and to move on, you in trouble. Because you're going to be learning till the day you get out of here. Okay? You got to keep up your credentials. You got to continue to learn, because people are going to be coming to you for the answers. you are going to be the go-to person. Okay? So you got to keep up. You got to read your journal. You got to read the website. You have to look at some of the things that they're talking about in the field. And even as a student, you should have your membership. How many have their membership? Naughty people. Naughty people. You need your membership.
We have some first quarter students here.
Okay, you first quarter ones, you're forgiven. But you really need your membership, because that's how you learn about the positions. They have the positions right there. As they're describing certain positions, you might think, maybe you look at clinical documentation specialist. I don't know if I'm qualified for that. That sounds like work, like I gotta touch a patient. No, you don't. You're gonna be looking at the documentation and talking to providers to tell them how they need to be documented and what you can code. That's how you're gonna learn about those positions. I still remember, I read an article, I was like, and I've been bypassing this position all this time. I was thinking to myself, I've been bypassing this all this time, because as a student you think, oh, I'm not qualified for that. Don't think that. That's how you're gonna learn about what to look for as you're looking for jobs. What I need to get into, auditing. Yeah, you can get into auditing too, even as a coder. Because once you know you're coding, you can start auditing people left and right. Because you're looking at the documentation and seeing if they're coding correctly. That's another avenue. For HIM or HIT students, you have a plethora of positions you can go into. Quality management, release of information clerk, scanning expert. Because now with EHR, you have a lot of opportunities. You're going to be scanning and verifying that things are in the proper location. Even implementation for EHR. With some of the classes that you'll have, like health, like information systems, right? You're learning about how to get the people to the table to talk about what you need for your system. You could go for that position. Project manager, like Ms. Stewart. Talk about what they need to do, how to get things organized, get the people that needs to communicate and then get on task, keep them on task so that they can meet the timeline so that you can meet your goal and achieve your goal. So the best way to know what you can get into, you better start reading those journals, start looking at those positions, and they have national positions too. Okay? So you'll learn a lot if you read those journals, because then you get to see the positions that are offered. And by reading it, even if you go for the interview, they might ask you, well, you know, I was in an interview one time and they asked about the RACS audit. Okay? Never participated in one, but I certainly been reading about it, and I let them know I was reading about it too. I asked them, have you had one yet? Okay? So just by reading, they know you're keeping up on your stuff. They know the type of person that you are. Okay? So you're going to want to read the journals to keep up and see what's going on in the field. If you don't keep up, you're going to be left behind, and you know what happens? They find somebody else that's on top of their game. They will find somebody else. Seize your opportunities. You have a lot of things that's there for you. Go to it. Mentoring. You don't know it, but you could be in a mentor program. Did you know that? Did you know AHIMA had one? They sure do. You can sign up to get mentored by anyone in the continental USA. Don't have to be any of us instructors, although we love to see our students. And we love working with them and giving them ideas and things that they can do. But you can actually sign up for mentoring when you graduate. You'll work with a professional, say what your goals are, what avenues you can go into. All that is there, and you sign up. You can just look for certain things for yourself. Okay? Those that are close to graduation, you may not have your book yet, or maybe you're wondering, what is that test like? What is the coding test like? What is the HIT test like? If you go to the website, you will get a Monday coding quiz, a Monday quiz. Did you know that was on there? If you go to the website and you start looking at credential stuff, they actually have a little mini quiz, 3 questions that they'll ask you that are really gonna be test questions. And most likely you'll probably see it. And you can answer the question, and they'll give you an automatic response. They'll tell you which text, which book is from. As you answer it, you might say, okay, this is gonna be in the 2013 RHIT Review Guidebook. Or you should be able to find this information from the Nanette Sales book, HEMA, HIM, and Applied Approach. Okay? They actually have the questions there. They have a whole slew. They don't erase it. So you can go on there and you can answer every question just to see if you know your stuff. Okay? The other thing, and other benefit with the HEMA membership, you have the COP. Okay? The communities of practice. Has anybody been on there? Those that have had membership?
HEMA.org. HEMA.org.
HEMA.org. As you go on there, oh, I should have brought my little marker.
Yeah. Don't have one.
Yeah, there's one here. You want to look for the COP. Oh, this one's dying.
The board is in good shape.
Aw. But it's called the Communities of Practice. And with that, it's when you go on your membership, usually you can elect for what things you want to get into. Maybe you want to be part of a type of, it's kind of like, think of an online blog, okay? They have like a little area where you can go and ask questions, okay? So they have one that's for student community. So as students, you can be on part of the COP. As they get ready for, as the year progresses, where it's closer to the fall, maybe by spring, they'll start sending out emails to the student communities for those that are interested in participating in a review, an online review for a certain test. They have one for the CCS. Oh, thank you, Ms. Williams. They have one for CCS. They have one for RHIA and RHIT. But it's the communities of practice. And one of the nice things about the community of practice, they actually, it's something that you may utilize, okay, even as a professional. I've been on there, I've asked a question, can you help me find something, you know? And sometimes they'll be able to give you information. You might get it from another state, they might give you a different way of thinking about a certain issue, but it's there. It's so that you can network and kind of get questions answered at your different things that may come up. They even they keep the streams online. They keep it there permanently so you can kind of refresh, look back at different things. So the community of practice is really nice. You have, it's great as students because they even have opportunities where you're, like maybe every week, you're handling certain aspects of, in preparation for your test. Or maybe you want to do more and volunteer. They have one for just volunteering opportunities. Okay, so the communities of practice is a nice avenue for you to look at on the AHIMA website. Okay. Any questions so far? So as I tell all my students, if you ain't on that AHIMA website, you're missing out. You're missing out. There's so much that's on there. Any question that you have is on that website. How much your test is going to be. How do I need to go as far as preparing for to take the test? How should I pay for my test? What are things I need to take for the test? Everything's on there. Yes, Lisa.
Is it updated on a daily basis, a weekly basis, or
As far as
just information in general? I would imagine it's probably daily, right?
It's daily, as needed.
as daily or as needed. Anything that comes out, even the update. When we were waiting to see what was the status for ICD-10, that was the go-to place. I kept checking. I kept checking to see what was going on. Were we going to be live for October 1st or not? They'll have it right there. Okay? Anything that you need to know will be right there. Even as far as when you take the test, what books I need to take. If you're going for the certification, you take your CCA, the S or the P. You can look on there and see when are they revising the test. Because for the test, you usually can get your results that same day. If they're doing an update, they have what is called beta testing. where there's a certain period of time where you're gonna get mailed your results. It won't be immediately revealed to you. So they always have that's there. They tell you when they're gonna do the next update. They tell you everything is on that website.
In conjunction to that question, I have another.
Okay.
You say to go to that coding quiz, so it would be a constant thing. Now,
Every
that's-
week they have one.
That's just a practice for the individual. It's nothing that would be put in, because if I'm a member, I sign up, they're gonna know it's me.
No, no,
It's
not
nothing
at all.
like a backlash of any kind, right? It's just a
No,
practice.
it's just a practice.
Okay, thank you.
You had to turn that.
Which-
I think this is tough.
Okay.
Thank
Let me see here.
you. Usually takes time for us. That's the point.
Oh,
Is this it?
there it is. So for the HEMA website,
Yes.
there's a lot of things on there, a lot. But what I'm gonna do, I'm gonna go to the home page, just so you can see how it goes on there. Okay? Yeah, it's not coming up yet, but it's coming.
There we go.
All right. So this is your HEMA page, okay? And incidentally, those that have gone to lab, that same ID number is going to be yours for life. For life, okay?
You'll memorize it.
You will memorize that number because the number I have today is what I had as a student. It does not change, okay? And so on the website, you can go, you don't have to necessarily have your credentials to go in, but you can go to certifications, and then they have different exam resources. And then here, just so you know, they have all the tests that's listed there, okay? Notice that every test is there, every single one. So if you want the exam details, you click on it. You want the resources as far as preparation, click on it. Go to resources for the HIT, and they have everything there. They tell you what's the job analysis is like, what's for 2005 versus 2010. They have exam specifications. They actually have a little crosswalk that's there. Cognitive level, eligibility, what it takes to sit for the test, okay? And then my favorite that I usually always go to, FAQs, frequently asked questions, okay? All that is there, okay? HEMA doesn't hide nothing from you. If you don't know, you missed something.
You missed it.
You missed it, period, because it's always there. It's always there. Now, the one thing that I like to show students, that candidate guide, where I'm clicking at, the candidate guide has it pertains to information that's going to show up for your test, okay? Regardless of what test you're going to have, it has information on each of those tests, okay? Read your guide, okay? When you get ready to sit for it, you're going to read it through and through, okay? Because there's certain things that you can take that's considered valid ID. What's considered valid ID, what's not, okay? They have it there. Now we have a new proctor. It was, I think it's Prometric. That's there, but it's there. And they updated. Notice the date, 2013. So this is the brand new one. Okay. So you're getting ready to go to it. You can open it up. You can page down. They have everything. Customer relations. How to submit your exam. Although you can pay, once you pay for it, you get information online, and you'll be submitting your online, your email account, and they'll send you a notice and things like that.
Now, we here at NC, when you take the course for the RHIT or the coding, your book is included and then your exam fee. Because what we do is mail them all in, so you don't have to worry about saving up that $300 or whatever to pay, because it's going to be part of your tuition. It's not that you don't pay for it, but it's going to be part of your tuition. We mail them all in. I do. Mail them all in. So then all you have to do is let them know when you want to schedule it. So I just want you to know that.
And that's just for HIT, right?
I think we're doing it for coding cert, but it's just a little different.
It's a little different, okay. And so anything you need to know is on here. They have a whole table of contents explaining what you need to do. They have each credential, what you need. They give you, for example, let's go to, we'll go to the one for, let's go to page 5. So they tell you everything regarding each certificate. And they're giving you the eligibility requirements, okay? This is RHIA. So they're telling you you need to complete a successful academic program or graduate from an HIM program and for an association, you know, and they give you all the verbiage for that. But you go to it and read it, okay? Everything's there. What you should do before, during the exam, and after the exam. They tell you what you need to know. After the exam, they'll be able to tell you, if you're not during the beta period, they will actually give you your results, okay? You'll actually know the strengths of where you were at. The one thing I can tell you about the program here at NC is that our grading scale, the first time I came as a student, I thought, man, that's hard. I'm used to 90, 80, 70, 60. I was like, what's up with that? But I can tell you that the grading scale that we have here is very much accurate as far as how you need to score to pass that test. It's like that for a reason. Wherever you feel you are deficient in whatever class that you take for HIT or for coding, for your program, those are the classes that you're going to want to probably spend the most, or the sections of information you're going to want to spend the most time on. Because for HIT, it's a plethora. I'm telling you, a plethora of questions. And it really is from each class. It's from each class. Okay? I still remember some of my questions. Okay? I had a question on what code 650, for 650, what is part of a normal delivery? Had to be able to identify what was not part of a normal delivery.
You should be able to answer that. They just finished chapter 14. And some had it twice.
Now, cardiology. I had a question on cardiology. How would you code hypertension and cardiomegaly? You had to know your rules of coding. There is about the rules. Because you don't need to have necessarily your coding. You will not have your coding book for the HIT. It's the rules. You need to know your rules. I had one on what code is used on the newborn record. Was it V27? Was it V30? V30, that's right. Another one for statistics. All the stuff on statistics. Yes, you have your formulas, but you need to know what you're looking for.
That's true.
You got your formulas, but you need to know what you're looking for. Quality management. You got to know all your graphs. Got to know your graphs. Information systems. You need to know the system development life cycle. Had questions on that. 100 basic things. Who's the owner of the record? Little things like that. That's right.
All right.
HIPAA. And HIPAA in general, when you take your test I always give as a tip, you're taking your test in regards to national standards. Don't think so much of the local, okay, but national standards. So when it comes to HIPAA, what things you need to know for HIPAA in general, what is TPO, right? Treatment, payment, and operations, okay? Different stuff as far as maybe, now they probably won't have this, but on mine they had information on what would be proper, how would you alphabetize a certain listing of names. What is the difference between middle digit filing versus terminal digit filing? Things like that. Now for the CCA, you do have the coding that's there. I know for CCS, you do need your coding manuals. And when you get ready to take your test, you do need to have the current manuals that they'll be utilizing for the test, because there's a certain portion that is actual multiple choice, and then the actual half is straight up coding. coding. So sequencing, all that comes into play when you're doing your sequencing of your codes. Okay?
Now, you know that Ms. Truncale is going to be your teacher if you're going to take the RHIT exam review course this summer. So you
Okay.
know you've got an excellent teacher. But she's going to have to be ready for that exam.
Okay. So every class that's for your, whether your certificate or whether your HIT, it's all in there. It is all in there. But the nice thing about AHEMA, they tell you the things you need to know. It's everything from our classes, it's there. And that's how we really structured the coursework here. And because myself, I'm in the field, Ms. Deb Ballantyne, she's one of our instructors, she's in the field. Ms. Kathy Layton, she's in the field. Incidentally, all three of us, we've all gone to ICD-10 training. So we're all trained as official trainers for ICD-10. We can all tell you what's going to be on there. Okay. So your information and the things that we do here at NC is really for your it's informational, and we make it that way so that you're prepared. We want you to know. Okay.
And
But
there's
I'm-
reason behind everything the instructors are teaching you. You wonder sometimes, why are they teaching us this? Why do we have to do this? You will see, it will come together.
Yes.
And you will remember your lecture. Just like when Ms. Truncale was asking you the questions, you can hear Ms. Williams telling you the answers and talking to you. It's a reason for that, you know.
And you do use it in the field, and I tell students all the time, even your textbooks, if you ever feel you don't know, take your textbooks to work. I took mine when I was at my first coding, I took my textbooks, and I sure did crack it open because I used them because the information's there. Don't think that just because it's a textbook, oh, I'm never going to use it. Yeah, you'll be pulling out them books no time at your position.
And as soon as you get ready to give it to somebody or throw it away, you'll
That's
figure out you
need it.
So keep
Yeah, it has a lot of good information, like the new version of the Johns, the HIM, an applied approach. The one now is the 4th, 5th edition. Nanette Sales is the author. That's a standard. I crack that book open all the time, looking at retention standards, different things on quality, performance measures. That's the go-to book. That's like the Bible. That book and the other one there's another one, concepts in management, I think. That one, the Latour Mackey book. That's another one. Those are main books that you look at and stuff. So don't think that your textbooks, you'll never touch them. You'll be opening them.
definitely will.
Yep.
And then how my life has gone full circle. Now I'm seeing textbooks written by teachers that I had in my HIT program. So that's another career. You know, one of my teachers works for AHEMA as a publisher, so, and a couple of other places. So it's just a wonderful field, and you learn so much. And the fact that you have to keep learning, then you can teach. You know, and then you can write. You can lecture.
One of the things that I definitely like to say is that don't think you can't impact another person. Even at the what I call the youth part of your career. Don't think you can't impact somebody. You know, I ended up getting credentialed. I was in the field for a number of years, and then I just said, you know what, I enjoyed teaching. I had great teachers and stuff, and I wanted to come back. I came back to teach for now, and I enjoy it. Those that's had me as an instructor, you know I like it. You know, I'm like a big nerd. I'm like, oh, doing all kinds of stuff. But, you know, it really is a lot of fun. And then one of the things that I always say, if you work in the field, open up a door at your place to bring students on board. It's the only way that you're going to have that opportunity for future professionals. And at the same time, it also lets others know, that might be your future employee. You never know. It might be. It's worked out at quite a few places that I know of, But at the same time, it's a great way of networking, and you give another person an opportunity to learn what it's like in that field. I always try to, if it's a great place and I feel that a student will do well, at infant welfare, that's what I did. When I was a maid, I used to bring all kinds of students over there. Come on down and learn about our paper records and all the things you need to know. And I had them working like they were employees. They were doing release of information. They were doing some coding. They were doing some filing because we had paper charts, organizing records, pulling charts for requests and such. So those things are great opportunities and stuff.
Right.
Even if you feel like you need a little bit more, volunteer.
That's true.
Volunteer. Don't think you can't volunteer at a hospital. One of the things I did when I was done, I volunteered. I went over to St. Francis up in Evanston, volunteered there for a few months to just see how their inpatient department worked. I was pulling charts. I was going down to the basement to get charts for release of information. I worked the inactive room, hunting down charts and helping them get the doctors that were naughty and so that they can sign their stuff. So you get a great opportunity to meet and to see the functionality of an office and stuff. So don't think that you can't do that either. Okay, Lisa.
My question to you, since we have the 3M and we're learning quantum, those are the two prominent applications in the field.
Right now, that's
anything in transition that we should know.
So with the VLAB that you're participating in, one thing I'm going to say, put it on your resume, okay? Don't think that you will not be able to note that on your resume. It's experience. You know how to navigate through the system, okay? So your experience in VLAB, list it. You know how to use it. It hasn't changed. Even the current versions, it's the same. You know how to navigate. That's what you're going to be doing. So list that. Yeah, I worked on, we had, and I wouldn't just put VLAB because not everybody would know that. List the programs. I worked on Quantum. I worked on 3M. I know how to do health port. Okay, you just start listing them off because it was part of your program and you got exposure to it. And at least they know that you're not a novice. You have some computer background that you'll be able to utilize those programs in your field.
Until you're proficient.
Yes, you'll gain your proficiency in that. They just want to know you're not fresh and that you don't know how to work a mouse, how to type on the turn on the computer. They want to know that you're savvy. And at least if you've had some exposure to an HIM program, you're in. You're in.
Thank you.
Okay. So visit the AHIMA website. Please go to it. Everything that you need is there. Everything you need to know is on that website and stuff. Gain your information and have confidence in yourself that you're going to get exactly where you want to be. Seize those opportunities. Yes, Ms. Williams.
I was just going to, we have a student, Ms. Kilzer, and I think she's taking advantage of the mentoring program through AHIMA.
Oh,
So maybe she
awesome.
would like to share her experience.
Well, it's not as much now, but I'm emailing and keeping in touch with my mentor. She's in Ohio, and she's going through a lot of hospital changes too with the new EMRs coming up and all that. But we're keeping in touch, and she's giving me advice and encouragement, so I'm very pleased with it.
Yeah. So it really opens up a lot of opportunities. I mean, even a little bit. A little bit of exposure goes a long way.
That's right. Well, thank you so much, Ms. Truncale. I was going to ask if you could ask maybe 3 questions related, just one at a time, to your overview, and let's see if we can give away a couple of door prizes here.
Okay. Let's see.
Something that's pretty obvious that you talked about, like, maybe what should go on your resume or where you worked, a couple of places you worked, things like that.
Okay. What are what were some things that I had mentioned as far as your networking skills? What are some good opportunities for networking? Yes,
Conference.
the conferences, that's right. Yep. A lot of conferences. And incidentally, every year, ILHEMA and AHEMA, they'll try and have one once a year. So you'll have one that's a national one, and then you'll have one that's for the state. Most of the time is ours for the state, will be in the spring. Most of the time ours are in the spring, and then the national conference is a little bit later in the fall. Okay. What is one of the I guess you could say social networking sites as far as what's our blog, as it were, for AHEMA?
COP.
The COP, that's right, Laura. The COP is it. So the communities of practice is there. As a student member, you have access to that, and you can go on there when you get an opportunity. So that way, and you're part of it. You can pick the sections you want to be in, whether it's student opportunities or future testing for RHIT. Whether you're already in the field, you can go to physician billing. They'll give you all the tips that's there, and so forth. And then lastly, as far as what's one opportunity or what's one avenue that's there that helps us prepare for our test on the website?
Monday coding class.
The Monday coding quiz, that's right. And so that is there. So every week, again, they have that on the website. It's usually 3 questions, but if you find it and you click on it, they have all the ones from the previous weeks, and they give you the answers for those. So, and those, incidentally, they come from us, the professionals, because they do send out little surveys as far as what do you see in the field. And so those questions, they come from actual professionals. That's how they develop that test. Okay? Any questions or comments? Enjoyed having you. And I look forward to seeing you. Know that we love our students. And if you take your test, let us know what you see. We love to know what's on the test, what you've actually experienced. Because like Lisa and this other young lady, they can go for the same day, but their test may be totally different. Okay? They have different versions of the test. So definitely give us feedback on what you see in the test, because that's how we tweak our program here.
I have a question.
Yes.
Now, what's basically the difference in being a AHEMA member or let me change that. Being certified by AHEMA versus AAPC?
AAPC is the American Academy of Professional Coders. They have a different program when it comes to certification, and their credentials are a little different too. Most people can just, it's not really, I can't say it's a real difference per se. However, I will say this, as a professional, from working the field and from being in different places and meeting other coders, nothing against the AAPC, but I'm telling you, an HIM, a HIT person, or an AHEMA credential person, they're on top of their game. I'm sorry. We are on top of our game. It's just different, because in the education skill, and I say that because we get a good background as far as both inpatient and outpatient coding. If you're an HIT, you get all the other facets of that. But I just feel like a HEMA credential person is more polished. They know more resources and than those that are just AAPC credentialed. Nothing against them, but I just feel like they're more polished and they're able to function. They see things more than the other. Just personally, my experience.
I wanted to add to that. Their focus basically is outpatient.
Mm-hmm.
You know, their focus is outpatient, so they don't have a strong background in inpatient. Whereas the AHEMA credential individuals have both.
That's true. And the other thing with AAPC, you have to specialize in each one. Whereas with this AHIMA, we teach you, or the program teaches you, like Ms. Williams says, both sides. And we don't have like a specialist per se in any particular program or background. Although you can get credentialed as such through AAPC. Like for example, AAPC, you can be a CPC, which means you're outpatient coder, but to do hospital, you gotta have an H. If you wanna go into OB-GYN and be specialized in that, they have a certain program where you have to take so many courses, and then that way you're certified as an OB-GYN coder.
Okay.
So they have a little bit more specialization there, but as far as that difference, I just feel like AHIMA is there. We have things on point. We're educating our professionals. Timely, I feel like there's just a lot more that's there.
May I just add this? What I've noticed, and maybe just, when I see the AAPC credential, evidently it must not be enough because they go back and get the AHIMA credential as well. I've noticed that. Whenever you look at the credentials, they always have both.
Yeah, and most of them, they find that, and what I've noticed in the field, because you can be, like for example, I'm a AHIMA member, and I order things from AAPC because of course they might have a good package or whatever. It's not that you can't go on those sites and go through, like, get a course from them or anything like that. It's just that it's very differently structured. And I just feel like AHIMA does a better job of keeping us informed and teaching us the important things that we need to know.
So they're more involved.
I do feel that way.
I must add this, Ms. Truncale has had the opportunity to work with other credential coders.
Yeah.
And so they stood out, AHIMA
To me, they
coders stood out among
and
the
beyond.
rest.
Yeah.
It was obvious that they were missing something in their education process. So you all are, because, our program is AHIMA certified, accredited, you all are getting what you need to be successful out in the workforce.
And it's not uncommon for people to get both because they want to kind of get some of the benefits. Like they may have a good package where you pay a certain amount, you can get so many CEUs. But their CEU management is a lot different than how we credential. Like, who knows how many credentials, how many CEs you need for RHIT or for CCS or CCP?
For your cycle, for
Your
your
cycle,
2-year cycle.
for your
you have to
CEU
get
cycle.
certified.
20, right? And so, for us, like if you are an RHIT and then you later become an RHIA, you just increase. You just increase more, so you'll end up getting 30 instead of 20 and such. If you end up being an RHIT and then you decide to get your CCS, then you just need to get an additional 10 more. It's not so much, and it's every 2 years. Okay, whereas AAPC, you have to meet so many CEUs every year. Okay, so their cycle period is different than how we have it. Okay, so nothing, again, nothing against the organization because they do have some really nice workshops and CEUs and such, but I just feel that AHIMA, we're the bomb. That's how I feel.
I agree. That's the site we want to go to. And then as Ms. Truncale talked about, as far as their career assist site, they have the excellent career and employment links. And they even have a link where it shows you what type of careers you can go into. Not a non-traditional, some of the coders, but then also, you could work for health insurance company, a pharmaceutical firm. I mean, you're not limited as long as it's related to healthcare.
Yeah. On the AHIMA website, if you go to careers in the tab up above, they have a section called HI careers. And as you go there, you get this little window that's here, and you can actually go and see, okay, what would I like to get into? They also have some jobs posted, hint, hint, in case you want to start looking around and stuff, but they definitely give you a lot of good information. The salaries, what it is regionally in certain areas. They have an HIM career map, and so if you go to it, see how you have, I'm going to just click on that. You have all these different ones. It's kind of broken off where you have a certain section, compliance. You got education. You got informatics and data analysis, IT, medical records, and so forth. As you hover over some of these, they tell you what the certain positions, titles it could be. Like for this one, it actually came up as a chief learning operator for the medical records administration. If you go to risk compliance, they got a chief compliance officer that's there. And then they tell you entry level what's available, and then you got your midpoint and your advanced, so that you can see what job titles could I go for.